Assalamu alaikum. Today I would like to talk on some WBC disorders. First of all, starts with the cell. This is the blood cell. This is monocyte, this is lymphocyte, neutrophil, eosinophil, basophil, macrophage, erythrocyte, and platelets. Okay. This is the picture of the neutropenia. And what does neutropenia mean? This is a picture of neutropenia. Neutropenia means decreased neutrophil count, and it happens in using some drugs and drug toxicity, some chemotherapeutic drugs, and it occurs due to severe infection like gram-negative sepsis. So gram-negative sepsis and drug toxicity like chemotherapeutic drugs, like alkylating drugs, chemotherapeutic alkylating drugs, which works via cross-linking of the DNA. These drugs actually causing neutropenia. Okay, this is leukopenia or lymphopenia, and in lymphopenia what happens that there are some cause like immunocompromised person, like HIV and DiGeorge syndrome, and there are some other cause like high cortisol state, like whole body irradiation and autoimmune destruction. So I actually remembered these four causes by IHA. That means immunocompromised person, high cortisol state, autoimmune destruction, and whole body radiation. And in whole body radiation, lymphocyte is the first cell to destroy in whole body radiation. Okay, this is the picture of neutrophilic. Look, this is a look at tons of neutrophil are present in here. This is called neutrophilic leukocytosis. In neutrophilic leukocytosis, the most common cause is bacterial infection or tissue necrosis. In bacterial infection or tissue necrosis, in here there is induction of release of marginated pooled and bone marrow neutrophils, including immature forms and immature cells. These immature cells are characterized by decreased FC receptor, CD16. CD16 is the marker to identify that there is an immature cell. This is the picture of monocytosis. In monocytosis, the most common cause of monocytosis is chronic infection, and M for M, that means malignancy. Chronic infection and malignancy. In chronic infection like TB, syphilis, protozoal infection, rickettsial infection, these are the most common cause of this monocytosis. Okay, now this is the picture of eosinophilia. This is the picture of eosinophilia, and eosinophilia actually happens when there is parasitic infection, when there is type 1 hypersensitivity, or when there is Hodgkin lymphoma. These are the three important causes that type 1 hypersensitivity, parasitic infection, and Hodgkin lymphoma. These are the most common cause of eosinophilia. This is the picture of eosinophilia. This is the picture of basophilia. When you find basophilia, the first thing you have to remember that CML, that chronic myelogenous leukemia is the number one cause of this uh, basophilia. And then lymphocytic leukocytosis. This is the picture of lymphocytic leukocytosis. This is the picture of lymphocytic leukocytosis. In lymphocytic leukocytosis, the most important cause is virus, and EVV, Epstein-Barr virus, is actually the first cause of this, and other is Bordetella pertussis. Bordetella pertussis. In Bordetella pertussis, it actually releases lymphocyte proliferating factor. Bordetella pertussis actually releases lymphocytosis promoting factor, which blocks the lymphocyte from leaving the blood to enter into the lymph node and causing lymphocytic leukocytosis. This is the picture of blood stem cell. This is the myeloid stem cell. This is the lymphoid stem cell. In myeloid stem cell there is myeloblast, and lymphoid stem cell myeloblast there is RBC. From myeloblast there is granulocyte, eosinophil, basophil, neutrophil, and from lymphoblast there is B lymphocyte, T lymphocyte, and natural killer cell. This is the picture of splenic infraction, and splenic infraction actually happens in EVB, Epstein-Barr virus. This is the complication of this complication of the Epstein-Barr virus, that splenic infarction happens in Epstein-Barr virus. That's why when a people is suffering from EVB infection, we actually recommend that patient to avoid contact sports for at least a year. If he doesn't avoid contact sports at least a year, he might die due to this splenic perforation. And there are some other complication happens when there is EVB infection. First of all, I am discussing the bad thing, then I will go through the normal thing. In splenic infection, the complication is the EVB infection, the complication is splenic infarction. Then rash can happen if the patient is taking amoxicillin, and there is dormancy, and we know that Epstein-Barr virus EVB actually hides in the B cell. So dormancy of virus in B cell, it causes increased risk of both recurrence and B cell lymphoma. This is high L. That dormancy of this virus leads to increased risk of both recurrence and B cell lymphoma, especially in immunodeficient, if immunodeficiency develops. And we know that and this is the picture of atypical lymphocyte in splenic, atypical lymphocyte in infectious mononucleosis. EVB infection results in lymphocytic leukocytosis comprised of reactive CD8 cell. CMV is less common cause than EVB. EVB is also known as kissing disease. It actually affects the teenager, and all you have to EVB, you have to remember this BOL, BOL, that EVB dormant the dormancy of EVB is in the B cell, and it can cause it can infect the oropharynx and causing pharyngitis, and it can infect the liver and resulting in hepatomegaly and elevated liver enzyme. And the thing it causes, it we know this is the picture. If we think about the histology of spleen, in spleen there is cortex, there is paracortex, and there is medulla. In cortex there remains B cell. In paracortex there there is T cell. And what happens in EVB, there is hyperplasia of these paracortex, there is hyperplasia of this paracortex. And the paracortex, and the other thing happens, that is that splenomegaly happens. Splenomegaly, why splenomegaly? Because due to T cell hyperplasia in the pulse. Splenomegaly, why? Because there is T cell hyperplasia, T cell splenomegaly. Look at there, that in white pulp there is pulse, and in pulse there is uh, splenomegaly happens in pulse due to T cell hyperplasia, and there is high WBC count with atypical lymphocyte in the blood. If you do monospot test, it is positive. It is positive uh, within 1 week after infection. So don't do it early, because it might be negative, but negative doesn't rule out that it doesn't have EVB. For confirming your diagnosis, you have to do EVB viral capsid antigen, EVB viral capsid antigen. And the other thing, last thing I want to share, that is that what is uh, monospot test. In monospot test, there is detection of IgM antibody that cross-reacts with horse or sheep RBC. It is called heterophil antibodies. And I have already told you about the complication of this EVB. That means infectious mononucleosis. What are those? Can you remember? Yes, these are splenic infarction. That's why we tell the patient to avoid contact sports. And there is rash, and there is dormancy, and dormant B cell can cause recurrence and can cause B cell lymphoma if the patient is immunodeficient. Assalamu alaikum. Inshallah, you will be benefited.